Welcome fourth year students. I'm Professor Safinaz Elhabashy. I'm going to cover in my first part of presentation a topic which is very important to me as a pediatric oncologist, entitled When to Suspect Cancer in the Pediatric Age Group. By the end of this part of my presentation, you should be able to explain symptoms suggestive of cancer in terms of frequency or incidence of cancer, to recognize conditions that are similar in their presentation to cancer, mimic cancer, to recognize conditions called the red flag signs of cancer, to choose and interpret results of initial workup, and by achievement of those four intended learning outcomes, you should be appreciating the importance of early referral of suspected cases. Our patients present late because they seek medical help late, or the medical staff are often not aware that cancer can occur in children, and occasionally inappropriate medical interventions are performed, further delaying the diagnosis. How to make an early diagnosis of childhood cancer possible? We have to work on three issues. One, high index of suspicion on part of the public and, of course, on the physician side. And unless you think of diagnosis of cancer, it's going to be missed. And this issue is the whole part of my presentation. The second issue is to work on the high-risk group. This includes children with neurocutaneous syndromes, children with chromosomal anomalies, those with immune deficiency states, and those who are at higher risk for other reasons, like a family with malignancy, previous malignancy in young age, siblings who had malignancy, including twins, children with liver cirrhosis, and children with congenital malformations and syndromes. The third issue is part of my presentation, which is recognizing the red flag signs of childhood cancer, where 85% of pediatric cancer are associated with those signs and symptoms. Every story has two ends. We always wish for the happy end of the story. And my story today is about the lag time, which is the interval between onset of symptoms and diagnosis and initiation of treatment. The two key players are the patient or parent on one side and the healthcare provider on the other side. Looking at the literature, the results are very variable. In this article, the median parent lag time was 2 weeks and the physician was 8 weeks. In this article, the reverse was there with a long delay on the parent side of 12 weeks and the healthcare system of 3 weeks only. Whether on the parent or patient side or the physician side, any delay in initiation of treatment would definitely affect the outcome of the disease. In this article, a minimum even of 3 days between diagnosis and the initiation of treatment affected the overall survival and the event-free survival. Both overall and the event-free survivals were inferior in patients who started treatment more than 3 days after being diagnosed. The 5-year overall survival means the time between date of diagnosis and time of evaluation after 5 years. And the event-free survival, for example, 5 years also, the time between the date of diagnosis and time of evaluation with no event. And the event here is either relapse of the disease or death of the patient. So the major contributors to delay were parents and the type of cancer in this article. On the side of the parent, a shorter lag time was reported in mothers younger than 40, and a longer time was reported among patients who are seeking second and third opinion, visiting many healthcare facilities before being diagnosed. On the side of the patient, a negative correlation was found between the age of the child at diagnosis and the time till being diagnosed. Also, on the side of the patient, the type of neoplasm definitely affected the lag time, with shorter lag time in aggressive cancer like acute lymphoblastic leukemia and non-Hodgkin lymphoma, with the longer one in patients with Hodgkin's disease and retinoblastoma, who both have a less aggressive disease course. On the side of the healthcare practitioners, little experience and knowledge, and sometimes reluctancy to consider diagnosis of cancer because of its ominous implications are factors that cause delay in the diagnosis. My message today is to raise awareness about the early manifestations of pediatric cancer to the healthcare providers of tomorrow, you, after being graduated, and you would disseminate again the knowledge to the public. Symptoms and signs of pediatric cancer. Cancer in children may present as a mass by itself, or symptoms directly related to presence of the mass, for example, pressure effects or obstructive effects, or non-specific symptoms related to the tumor like secretion of cytokines, hormones, and other products, or due to metastatic spread of the mass. This pie shows the incidence of childhood cancer. Leukemia, brain tumors, and lymphoma account for more than 60% of cases, and neuroblastoma comes on the top of the remaining solid tumors. It's so difficult to list cancer symptoms and signs because cancer is so diverse. And diagnosis is further complicated because many signs and symptoms like fever, bruising or hemorrhage, and headaches are frequently met in healthy children. But as leukemia is around 30% of cancer cases in pediatrics, so patients might present in descending orders according to the frequency of type of cancer, presenting with anemia, bleeding, bone tenderness, lymphadenopathy, and hepatosplenomegaly are all manifestations of 1 leukemia, 2 lymphoma, headache and vomiting as manifestations of increased intracranial tension in CNS tumors. Then the rest of cancer solid tumors might present with a mass in the abdomen, in the mediastinum, or in an extremity. And the manifestations of others than this would be constitutional, like fever, weight loss, and so forth. Symptoms and signs of cancer can be collectively collected in the acronym child cancer. The initials of the acronym would explain the different signs and symptoms. So C stands for continued unexplained weight loss, headache for H, I increased swelling or persistent pain, L lump or mass, D development of excessive bruising, bleeding or rash, another C for constant infections, and so forth.